Hi, and thank you for joining us for Enloe Medical Center's Healthier Youth Facebook Live. More than 70% of Butte County students were polled and recently reported that they know somebody in high school or younger who are currently using e-cigarettes, also known as vaping, according to our 2019 Community Health Assessment. Yet, the Center for Disease Control and Prevention, often referred to as the CDC, reports that vaping is unsafe for teens, youth, and young adults. That's because e-cigarettes contain nicotine, an addictive drug that's found in tobacco products, and affects young people's brains, which continue to develop up into the age of 25. Hello everyone, I'm Susie Lowry Hall, and I'm Enloe's Community Outreach Coordinator, and I am joined today with Dr. Andy Miller, who's the Public Health Officer with Butte County Public Health. Today we're going to be talking about vaping, the risks to our youth, and more. But before we get started, please remember the information that we're about to share is not intended to be medical advice. If you have questions about your health or the health of a loved one, please make sure you speak with your provider. But as always, join the conversation. Post your questions and comments in the comment field, and we'll do our best to answer them throughout the broadcast. So with that, we'll get started. So thanks again for being here.
Oh, it's my pleasure.
So let's start with what are e-cigarettes? What do they look like? Kind of educate us a little bit about what they are.
Great. Well, I brought a few with me. So while I'm talking, I'll show them. So an e-cigarette is a device that has a battery, usually a lithium battery. It has a chamber for a liquid, and then that battery drives a coil which heats the liquid up into a vapor, and then a user then inhales that vapor into their lungs. And so this one is a vape pen. I also brought with me a very popular vaping device among youth, and that is the Juul, which is a rechargeable using a USB connector, and it has these different cartridges that hold the liquid. And another that's become quite popular is the Soren. And again, all of them have those components. A battery, a way to heat, and a chamber, and then a space for the liquid. And here's an example of a liquid. So this liquid will have lots of nicotine in it and is therefore very dangerous for people to drink or if children get into. So that's what they are and how they work.
That's very helpful. Thank you for bringing that. That was great.
Sure.
So let's look at the data nationally. So what is the data telling us between youth and vaping?
The data is really worrisome, which is why we're talking about it and why you hear so much about it. So very recently, a study was done that showed that 27.5% of high school students have used a vaping device in the last month, and that 20% have used a vaping device more than 20 days in the last month. So those are high school students. Then if you go to middle school, 10.5% of middle school children have used a vaping device in the last 30 days or in the last month. So those numbers have gone up dramatically, both in the country, in our state, and in our community, in our county, in our cities as well. So the concerning thing is that everybody's concerned about the acute lung injury, and I don't think we're going to talk much about that, but we can. That's very concerning, but also concerning is there's a whole nother generation of people addicted to nicotine. Kids don't often even know that there are nicotine in these products, and they're often a very high concentration of nicotine. And children in the developing brain are particularly susceptible to addiction. So those are the concerns.
Yeah, absolutely. So you had mentioned that it's a problem here locally. Can you expand on that with us? Share a little bit about what we're seeing here and the trends here.
Sure.
In
Yeah.
County?
So I spoke to a vice principal of a high school here recently, and he told me that in the last 3 years they've had a 1,200% increase in education code violations due to vaping devices. So that's really a quadrupling every year for 3 years. And it's the largest problem that they face now. And that's what the Chico Unified School District has told us, is that almost all of their disciplinary action is now about vaping. So it's an enormous challenge for the schools.
Yeah, that's very concerning, I'm sure, for myself as a parent and for the people who are watching.
Sure.
So let's talk a little bit about what's happening here. So what is it exactly that children, if they decide to vape, what are they inhaling? Can you explain that a little bit?
Yeah, so really they don't know. So every different device and every different liquid can have different things.
Okay.
So when they vape, there's a liquid that almost always has nicotine if it's a product like we're seeing here. Sometimes instead of nicotine, the liquid can have THC, which is the psychoactive component to cannabis. Also in the vape pen, there's often a carrier molecule like polyethylene glycol. It's very common. And additionally, there can be flavors, and both polyethylene glycol and the flavors have to be approved by the FDA as a food additive for them to be used, at least in the legal products. But they have not been tested in inhalation. And so things that you may hear about in the news, like vitamin E acetate, is approved as a food additive, but is one of the chemicals causing the problems with the acute lung injuries because it's never been tested as something to be inhaled.
Yeah, so that was my question. So something we hear a lot in the media, if anyone's been hearing about what's going on, it's EVALI.
Yes.
So can you explain what that is and what the symptoms are? Is that what you're referring to?
Yeah. Well, so again, there's two challenges. There's the concern about the acute lung injury, which is what you're asking about, and I'll get to your question in a second, I promise. And then there is the long-term effects of just having a whole nother generation of people that are addicted to nicotine and the long-term effects of that. And so the EVALI, which has brought a lot of attention, unfortunately, is more dramatic, but in the long run, maybe not the largest problem that we will have. But anyway, EVALI is e-cigarette and vaping related acute lung injury is what EVALI stands for. And the most common side effects or symptoms are like those of an acute lung infection like pneumonia. So shortness of breath, cough. Interestingly, a fair number of people also have nausea and vomiting. But one of the challenges with it is that you can't tell the difference between it and an infectious etiology like pneumonia or bronchitis. And so the diagnosis and the definition requires that all of those have been ruled out. So there are 2,291 cases of EVALI in our country so far, but those are only the ones that have made sure we've ruled out pneumonia, bronchitis, and they've been hospitalized. If they don't meet those criteria, they don't even make that list. So there are likely many more that weren't ill enough to go to the hospital.
Yeah. Wow. So would it be, if someone does end up going to the hospital, it would probably be helpful for them to again share with some of the things that they're using to maybe share that, because that could be helpful.
And emergency room doctors throughout the country have been coached and are willingly trying to ask those questions.
Oh, okay, great.
Of course, they don't always get truthful answers, but most of the time they do.
Yeah.
And it's important because it affects how those patients are treated.
Yeah. Wow. So going back to e-cigarettes, a lot of people use e-cigarettes in an effort to stop smoking. Yeah. However, the CDC doesn't recommend it as a way to stop because we don't have enough information. So what's out there for those folks who are trying to quit smoking and this is not recommended at the moment?
Right. Well, so there are a number of FDA-approved smoking cessation approaches. Mm-hmm. There are medications, and there are a few of them. There are other nicotine replacement options like gum and patches and inhaled nicotine. And there are other behavioral kinds of treatment. If people are interested in quitting smoking, we want to encourage that. I, as a family practice doctor, went down that path with many, many patients over the years, and it's difficult, but if they stick to it, they're usually successful. And there are some things that can help. So in the state of California, there is the 1-800-NO-BUTS phone number that they can call, and from there, they can be kind of transferred. If what they do is chew tobacco, there's a different pathway to go. If they are vapors, there's a pathway to go there too. So that's a good place to start. Locally, you can go to buttecounty.net/tobacco-free. So that's buttecounty.net/tobacco-free. And you will find a connection to a lot of resources to help people quit smoking.
That's great. Thank you so much.
Sure.
Well, this has all been really great insight. Before we wrap up today, is there anything else you'd like to share before we sign off?
No, I just appreciate Enloe and this opportunity to get the word out. I think that one of the problems is we have many young people that don't understand the risks. And so I think forums like this are very important, and thank you for for having me.
We appreciate you coming, and thank you everyone for watching today. Thanks for joining us, and we will see you at our next Facebook Live event on February 20th, where we talk about cardiac care in honor of American Heart Month. Take care.